discussing contentious issues in healthcare and rights to health. The aphorisms on health, such as those posited by the ancient Roman poet Virgil, the 17th century English clergyman and historian Thomas Fuller, and the writer Jim Rohn, suggest that health is wealth, and that health is not valued till sickness comes. Also, the charge to take care of one's body is of utmost importance and indicates the distinctive role that good and affordable health care provides in the survival and continuation of the human species. For without a sound mind existing in a sound body, it would be literally impossible to function properly as one ought to by making adequate contributions to the development of the society. So the right to good and affordable health care, therefore, has a significant impact on the present and future stability of a people. However, there are contentious issues in healthcare and the right to health of people that needs to be adequately tackled in order for it not to pose as threat to the continuance of a people. These contentious issues in healthcare and the right to health are woven around such things such as access disparities identifiable with such factors as socioeconomic status, disability, gender, and so on. Also, there is the problem of distribution of scarce resources like shortage of healthcare providers, facilities, and the equipment to take care of the people when the need arises. Also, knotty ethical dilemmas in patient care, such as problems arising in informed consent, end-of-life decisions, putting a human face to the relationship between potential patients and healthcare providers and practitioners, and the issue of confidentiality. There is also the inherent tension between individual autonomy and community needs in public health policy. So these contentious issues identifies discontinuities or gaps that exist between acknowledged universal rights of man to health and its practical realization, especially for marginalized populace. And it emphasizes the demand for structural changes in order to attain equitable health outcomes for all. So the main idea woven around good and affordable health care system, which underscores the right to health of an individual and the community at large, is entrenched in the system that allows the concepts of justice, equity, and equality to prevail. Justice in the sense that everyone deserves the right to be treated fairly, especially when it comes to the issues of safety and preservation of life. Equity in the sense that everyone is treated equally without giving undue advantages to those undeserving of it. Equality in the sense that everyone has the same rights to health, irrespective of ethnicity, gender, socioeconomic status, and disabilities. Therefore, it is a prerequisite to understand how the right to health functions in practice, which reveals a broader perception of particular national and local context and the structural factors that these health outcomes show. Now, what is the right to health? The legal basis for the right to health can be located within the international law and agreements, such as the 1948 Universal Declaration of Human Rights. This declaration contains in Article 25 that everyone has the right to a standard of living adequate for the health and well-being of himself and his family. More recently, the 2005 UNESCO Universal Declaration on Bioethics and Human Rights also states that the enjoyment of the highest attainable standard of health is a fundamental human right and that the access to quality health care and essential medicines is required because health is essential to life itself. Furthermore, the UNESCO Declaration asserts that the promotion of health and social development for their people is a central purpose of governments and all sectors of society. Now, what has rights to health been obtainable in Nigeria by the citizenry? It should be noted that Nigeria is a signatory to numerous international treaties and affirms commitment to recognizing and upholding the right to health. These treaties include the 1966 International Covenant on Economic, Social, and Cultural Rights, which states in Article 12 that the state party to the present covenant recognizes the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. Now, coming closer home, we have the African Charter on Human and People Rights, also regarded as the Banjul Charter. The main aim is to promote and protect human rights and basic freedoms in the African continent and to enforce the African Court on Human and People's Rights. Then we have the fundamental right of Nigerians to health, which is guaranteed by Article 16 of the African Charter on Human Rights and People's Rights. With the exception of the African Charter, which has been incorporated in Nigeria's domestic legal order, no other treaty bearing on the right of health has direct application in Nigeria. However, the 1999 Constitution of the Federal Republic of Nigeria, as amended, states that the basic rights of an individual entrenched in the Constitution, which guarantees the right to life, right not to be discriminated against for any reason, be it disease, gender, and status, are not respected. Quite often this happens. Now, Section 42 of the 1999 Constitution of the Federal Republic of Nigeria, as amended, provides that a citizen of Nigeria of a particular community, ethnic group, place of origin, sex, religion, or political opinion shall not, by reason only that he is such a person, be subjected either expressly by or in the practical application of any law in force in Nigeria or any executive or administrative action of the government to disabilities or restrictions to which citizens of Nigeria and of other communities, ethnic groups, and so on are made subject to. In essence, the section 34A of the 1999 Constitution as amended says that every individual is entitled to respect for the dignity of his person and accordingly. So we have seen that even the National Health Act of 2014 notes that the acts are to establish a framework to the regulation, development, and management of a national health system and to set standards for rendering health services in the Federation and other matters that concern it. In essence, everybody has a right to health, but quite often their rights are denied them one way or the other. For instance, the recommendation that was abolished that states that a person that is injured needs to get a doctor's report, especially if it's in case of gunshot wounds and so on. This law has been amended, and unfortunately, we still have occurrences of such happening. So that's the reason why this particular topic is important, because everybody needs to know that, one, they have the right to health, which is not the same thing as the right to having a healthy life. that one is a personal option, whether a person wants to be healthy or not. But everybody has a right to life. And the first thing that we need to note is that we need to take the right steps towards ensuring these health rights and advocacy are taken care of in Nigeria. So all stakeholders must be held accountable for whatever goes wrong in the system. The stakeholders are you and I, the government, healthcare providers, and everybody that may be under threat, whether in the future or in the present, to having their health care rights taken away from them. Thank you.
Yeah, thank you very much, Nara. That's a presentation. And we decided we'll be looking into the issue of health and healthcare, and you've already launched us into that. The issue of health, your right to life, right to health, talking about. And then you do in the beginning you were like talking about health care having only to do with illness, physical illness. So along the line, you also mentioned state of mental, emotional well-being. Because health encompasses all those, not only a set of physical, mental, emotional well-being. And that is really where we come to that mental illness. As also having that right to health also covers those areas. But when you get to the street, you see people that are mentally challenged, abandoned. Then when you look at all those issues, even infertility is seen as a disease. So if everyone also have the right to health, even if we consider infertility as a disease, infertile person also has the right to access medical attention that will take care of that infertility, that will care for it, maybe in form of assisted reproduction or however you can do it to either circumvent that infertility or to cure it. So the issue of health also takes us to, when we look at the community level, national level, also get to the global level. And our intention is to talk about the health, then we then connect with the issue of universal health coverage. We are still going to talk about it. It's a nice presentation that we're able to unravel the critical issues in health and healthcare. Let's hear others what they say, and then the point I want to make is that emphasis should also always be made on the scope of health, not just about physical well-being, emotional, psychological, and all those things that destroy human life and flourishing to be captured under health and healthcare. Thank you.
You're welcome. I want to make a few comments and then I'll ask a question. Well, number one, right to health is based on right to life. It's only when somebody is alive, excuse me, you can talk about right to health. Let me begin from the question. Does the individual have a part to play in order to make the right to health a reality, not just an aspiration that is captured in discussions, workshops, and all that? Is there any part the individual person has to play? Number two, if you say it's a right, is it actionable? Is it justiciable? Can someone take the government at whatever level, whether local, state, or federal, to court for an abridgment of one's right to health? Because if you talk about right, if it is not actionable or justiciable, like I said before, it will remain a mere aspiration. Another point, another question. What is the role of traditional medicine in actualizing the right to health. Because the right to health must have an outcome. And I'm sure that there are various components that would play a part in achieving that outcome. So what is the function of traditional medical practice in actualizing that right? Then the comment I want to make is that I'll begin from the quotation of the ancient Greeks, which says, "Mens sano in corpore sano," which means in a healthy mind, in a healthy body. That statement to me points to what I may call the symbiotic relationship between mental health and physical health. Part of the problem really is that sometimes genetic abnormalities can, like I tell people that sometimes some people come to life, before they even start living, life has already given them one go to nothing. If you are born with some genetic issues, life has already given you 1-0. Therefore, which means that when you talk about fairness in terms of accessing or actualizing that right to health, there must be instances where those with genetic issues should be accorded some priority, because whatever health issues they are dealing with, you cannot attribute it to their own careless living. You may not even be able to attribute it to their parents. It's just a genetic thing, which by their circumstance of birth, they are confronted with. So I think that, because you mentioned disabilities, there are disabilities that are actually genetic, that the individual, whether the parents or the individual directly involved, have no part to play. And that is also why, like I said also, that in some cases, when you talk about fairness, it must include the idea that those who have congenital issues should have priority. Because if I live a reckless life and I'm smoking all the time, and then I start having problems associated with smoking. Meanwhile, there's also a gentleman who has inherited, for example, poorly developed lungs as a result of genetic mutation. For me, if there is any treatment, the person that has that genetic issue should be considered first, before the person whose reckless lifestyle puts him or her in the condition in which the person finds himself or herself. Let me, in closing, I want to also point out a situation that is very dangerous to health in Nigeria and other places where excessive supernaturalism have taken hold on people. I'm talking about all these quacks claiming to be capable of dispensing miracles. We have, I'm never tired of making this example. Dora Kojile is supposed to be a professor of pharmacy. She died out of cancer. Now, the son was given appointment by the current Anambra State governor. And when he was being interviewed, the young man lamented that the mother, instead of seeking treatment in accredited modern medical facilities, she was going from one church to another, spending millions until her cancer got to the stage of no return. By the time they took her to India or wherever, there was little or nothing anybody could do for her. So part of right to health, education, right, information is very, very important. And it's also necessary that we should have medical practitioners that have empathy. This idea, you mentioned it. There's a case of an RI staff. It's all over the news. And robbers came, she had issues. She was rushed to the hospital and they were demanding an identification. I think it's very, very important to point out that in talking about right to health, the people at the front line, I mean the healthcare practitioners, need to be educated that life first before any consideration. Even if the person is an armed robber and a gunshot wound, the law states, as you noted, that save the life first. The idea that a young lady is in trouble, his life is ebbing away. And what matters to the people in the hospital is an identification. I think the right to health should also entail enforcement. The people whose neglect, who instead of focusing on saving a life are more interested in identification, they should suffer some sanction as a deterrent. Because if they had attended to that lady, perhaps she could have been alive today. And once a life is lost, nothing you do matters anymore to that life, because it's irreversible, it's irreplaceable. In fact, it's absolute. But when you talk about anything being absolute, it's your death. So I think that the lecturer has captured some of the salient issues that are important in issues of health. But there's also an omission, sorry, but let me add this. There is need for enlightenment campaigns so that people will not be too prolific in producing children. Because the more you produce human beings, the greater the need for healthcare facilities. And the impact of the environment is serious. You need to cut down trees and forests to build hospitals and other facilities that are needed. So you cannot talk about right to good health without also looking, even if it is sideways, at the issue of demographic discipline. Thank you very much.
Yeah, thank you, Prof. Let me make another contribution. Yeah, Prof, you mentioned the issue of, an example of someone who is a smoker, who lives careless life, and then when develops lungs problem, and someone who has been living decent life, and then also has lung problem, then in treatment, we are going to give medical priority. I think that brings also the issue of justice in allocation of scarce healthcare resources.
Yes.
Let's say and this is also a big problem because we're talking about rights to health. Is there a distinction in age in this instance? For example, we have 10 patients queuing for kidney transplant and have only 2 kidneys available. And they have someone of 90 years old, 70 years, 20 years, 30 years. And the common practice is that you consider those the younger ones. So in that case, are you denying those elderly people their own right to health? Or does age diminish right to health? That is one thing I also probably want to maybe cast more light on that area. Then secondly, the issue of right, we're talking about right to health. We also need to address other factors that contribute or deprive people of that right to health indirectly. Let's say in Nigeria, medical doctors are trained here, 100 medical doctors, and all of them leave the shores of the country. And then the people that's supposed to take care of are not being taken care of. that movement, that Jagba syndrome, is it not having negative effect on our enjoyment of our own right to health in our countries? When the medical professionals are leaving the shores of the country, maybe in search of greener pastures, because of bad governance and corruption, and then we that are back, staying back here, are not treated. So our own right to health, how are we going to go about it? And then the issue of enforcement is also very important. I need to address it because government need to look at it. When medical practitioners, the people who have entrusted our head, are not doing what they're supposed to do, there must be legal action so that they will seek up. So probably that issue of allocation of scarce healthcare resources and the issue of migration of health workers, how are we going to handle this situation?
All right, thank you. For me, we are assuming that all things are equal. You talked about the age range from 90 to maybe 20-year-old. The assumption is that the kidneys that are available actually match all of them. Because sometimes these organs select bodies that are compatible with them. So the presumption is that 1 out of the 10, the 2 kidneys are also compatible with them. It's not as straightforward as you think. Take for example, assuming there's a Chinua there. So people will say, look, we would rather give the kidney to Chinua because of his creative input in literature. Whereas some people will say, at 90, this fellow is at the departure lounge. He has virtually lived his life. Let's give the younger ones an opportunity to live. To be frank, there is no controversy-free choice to be made. Any choice you made or you make in this situation will always have the pros and cons. And if you stipulate by legislation how it is going to go, it will still create the problem. Because if you say, let's give it to Chinua because it's a creative writer, yes, it's old, but the creativity is still there, he can still contribute more than to give it an anonymous 20-year-old who may turn out tomorrow to be a terrorist or a kidnapper. You can also argue that that 20-year-old can turn out to be a future Chinua Achebe. So there's no easy solution. There is no easy solution. And these hypothetical cases are the cases that bring out the ethical dilemmas in such situation. But all things being equal, really, I think it might probably be preferable to give the kidney to the younger ones because they have, longer lives to live. You cannot guarantee that they may not make better contributions that may be at pair or even supersede the one made by Chinua Achebe. And in any case, an enlightened old man can say, look, I've lived my life, let the younger ones have the kidney. But the important thing to realize is that there's no decision that is completely correct. Each decision you make has its own positive side and the negative side. Regarding this idea of leaving medical practitioners leaving the country, in fact, unfortunately, it will be difficult to legislate about that. In the first place, because every human being generally wants improvement in their lifestyle. Every human being also have their own philosophy of life, whether consciously or articulated or unconsciously. People have certain guiding principles because in spite of all this, there are still some doctors remaining who still believe that no, let's stay here and stick it out. Well, if you are talking about individuals deciding to go and look for greener pastures, well, there's really little you can do about it, except if, for example, since up to now government is still subsidizing medical education in public universities, you can say, once you qualify as a medical doctor in Nigeria, I think I've even had that kind of thing mooted somewhere, that you should serve for some years before you can be qualified to exit the country. I find that unless you make that kind of legislation, and if you make it, I can guarantee you that Nigerians will find a way to circumvent it, being the kind of people we are. So Nigerians will find a way to circumvent it. The thing is that government should actually make the living conditions in the country better, so that that desire to seek for greener pastures. You know, I hear some people say, after all, it's not everybody that goes out there. It's fine. But once that perception is there that that place provides a better opportunity for decent and dignified living, people must continue to go. After all, there was a time people were not living in Nigeria. There was a time people were coming from overseas to take medical treatment in the tertiary health facilities in Nigeria. So the truth of the matter is that the major blame is on the government. You know, they have made living conditions in Nigeria so unattractive that even some people find going to other African countries a more palatable alternative than staying here. Yes. So if you look at it, yes, it has a way of abridging our capacity to enjoy that right to good health. But you cannot tell an individual who feels that going from point A to point B will ensure himself and his family better living conditions. You cannot blame the person. If the environment is not conducive, if the environment is more or less like a dream killer, then individuals will always want to find a way to go and exercise their capacities where conditions based on their knowledge and on their perception are more conducive to how they want to live. So I think the onus is on government to handle the resources, both human and non-human, within the country in such a manner that majority of Nigerians will start living decent lives and have a greater opportunity both as healthcare providers and recipients of those outcomes from healthcare practice, so that they can live decently as human beings. So there is nothing anybody can do to prevent individuals from living. And if government wants that to stop, or at least to get to the barest minimum, people in government, they know what to do. Govern properly. Let the standard of living generally show evidence of improvement. It's not the kind of thing you see in paper. They will throw statistics around. Oh, GDP is growing. Debt to GDP, all those kind of. They forget that statistics, like I keep saying, are like bikinis. What they reveal is interesting, but what they conceal is even more interesting. I will now close by also reminding Nigerians that they have a rendezvous with history in 2027. If they are not happy with what is going on, what do? Very simple. Dust up your PVC. Go out there and vote for candidates you think that will govern well, and make sure that the right to health enshrined in all kinds of documents does not just remain something on paper, that it should be something that will be of impact on living human beings. I think that's the much I can say at this point. Thank you.
Yeah, thank you very much.
Yes, actually, even some of the questions that Prof asked, he has answered them. I have them right here. Does the individual have the role to play? Yes. First and foremost, the individual has a role to play. Like Prof said, if we want an improvement in the structural facilities and the kind of provision healthcare practitioners provide, then we need a good governance. need a good governance, and the individual has a role to play that is lacking so that his life is made worthwhile. And also, the individual has a right to make sure that he lives healthy. Because if the individual does not take care of his mind and his body, definitely he or she will be a good candidate to always visit health facilities. And what is the role of traditional medicine? We can't jettison the importance of traditional medicine. Most of us grew up with maybe our grandparents and maybe even our parents introduced us to the use of traditional medicine when we were small. And we have seen the efficacy of some of these medicines. So we cannot say that these medicines are bad for us. We even have cases whereby people, that is foreigners, come here to learn more about traditional medicine. For instance, a few months ago, there was a conference carried on I think it was conducted by the IADS here, that is the Institute of African and Diaspora Studies, in which traditional practitioners of medicine came from all over the continent. And some of them came with some of their products, and even medical personnel were also there. So they can actually work together. They can be a sort of symbiosis, if I can use the word, for them to work together. And then can a person take the government to court? Is the right actionable? Yes, the right is actionable. And I've seen cases whereby even individuals won against some medical practitioners. For example, I know of a case of a man whose wife gave birth to a daughter. And unfortunately, in the treatment of the baby, something went wrong due to the negligence of the medical personnel. Although it took years, but this man actually won the case in the long run. And then the child was taken to the US for further treatment. That's about 10 years later, though, because we know how the justice system is in the country. So like I earlier said, that the idea is enshrined in the word, in the concepts of justice, equality, and equity. Everybody has the right to health, just as they have the right to live.
Right, just my own little input is that for me, the question of health is an existential matter. Existential in the sense that it concerns human beings. But even at that, it goes beyond human existence. So for me, beyond existentialism, we have to adopt a holistic approach towards it. Because the health we talk about is not possible without the environment. And much of what we use in curing ourselves, whether within orthodox medicine or allopathic medicine, is derived from the environment. So we need an orientation of life that is not just anthropocentric, that is, how do I put it now?
Biocentric.
Not just biocentric, it's a harmony of the both biocentric and anthropocentric, in which there should be complementarity between humans and the environment. Now, take for instance charts. I think he has a problem of cancer, and he was advised to use orthodox medicine. He says no, he's using the traditional medicine, the family medicine. For him, it's more reliable for him. That's what he uses. Now, this issue of cancer, for instance, or kidney transfer, lung transfer, liver problem, there are other traditional means that work. They may not work at the same level of, maybe you consider it maybe at the level of yielding quantitative result, like kidney transfer, but they have their own variables that the orthodox approach does not have. For instance, we know of one of us here, Carlo, I usually use him as an example, who I know has handled over 10 cases relating to heart, kidney, lungs, liver, and he does not do it by transplant. He does it through other means. And the question that the visitors from America, Russia, England, and France have asked him is that in medicine, if you are going to transplant an organ, the patient that is receiving that organ, the body must consider a lot of things, the genotype, blood group, or whether the body will accept the organ that is being transferred. But in his own case, you do not even need to transfer the thing, not even need to transfer a human organ. All you need is a semblance of that same organ. The focus is on functionalism of the organ. What does the kidney do? So if the human kidney can do so, the kidney of an elephant does the same. The kidney of any mammal does the same. So at the condition you are at this point, all you need to do for this own method is that get a functioning kidney, a kidney that is functional. If it's a right kidney, you get a right kidney of an animal. If it's a female animal, you get a female. Whether female or female, I think it doesn't matter the gender, but what it matters is whether it's right kidney or left kidney. Then you do what you call a vegetative transfer, and then it's a funny method which I have seen myself. You get it? And the first one I witnessed was a lady who returned from London. Obviously, she came back to Nigeria to get to her hometown Calabar and go and die, because the first kidney was gone. The second kidney was functioning at 30%, and they told her she had less than 3 months to go. So she was in Lagos to buy things and then go back to Canada. She refused. Then somebody referred her to Carlo there. And what they asked her to do, for me, it looked funny as an intellectual that I'm used to the process of inquiry. It looks funny. And I was watching, what are they doing? Told the lady to go and get a kidney. I said, which of the kidney? But before he did anything, the first thing he asked the lady was, where is your hospital scan result? So he looked at it, and then he looked at it, he said, okay, this is the kidney that's left. Go and get that part of the kidney, this side. And they went to market, they got it. He said, okay, bring your handkerchief or anything that you know is from your body. They brought it. And then he said, okay, use it to touch that part of the kidney, and then meditate on it. So put it there, just leave it there. So go inside, change the water blouse, change your blouse that you wear, the inner one, bring it on the ground and write your name. She wrote her name full. And they said, Odago. She left. I was like, what would they do? So I couldn't wait. I left. The next day I went. I now saw the plantain plant that is there. The lady's can have been one of it. The lady's name written on it, sellotape, this nylon sellotapes, so that rain doesn't wash it away. And every point of intervals of some point, they will go there and say some words and say, as this plantain, you know, the thing about the plantain is that when you cut a part of the plantain out, it regenerates. And so they keep saying, as this plantain is regenerating, then the kidney regenerates. So they told the lady that when it is a full cycle of what the plantain generates and brings out fruit or whatever it's called, she should come back. Exactly a year, the lady came back with a report that the kidney was fully restored. That's what brought the researchers from England there, and they brought 2 other people with now heart problem, and they treated them. So you see, what I'm saying is that the method is wired. Are you getting it? It doesn't follow the orthodox method, but it works. So we should not just rely on one method. That's why we need complementary holistic approach. All methods that can save life should be encouraged. Insofar as there is a result that it saves life, it should be encouraged. Because none of them is waterproof, none of them is perfect, because human life is not perfect. And the day we attain perfection, that's the end of life. But I'm trying to say we should bring in a kind of Feriban's approach here. Any method that works, and insofar it works and edifies life, should be promoted. We should not rely on just one method, and we should make it a choice which method you prefer. But the method should be well researched, well documented. It's not something we should do try and error, because human life, whether human life or plant life, is not anything we should play with. That's my own take there. There are some other methods that work. We should seek out these methods, promote all the methods, and make sure the researches on these methods they are improved, and then we will now be left with choice. Again, what I found interesting here again is that what is applicable to orthodox medicine is also applicable to the other side. When you bring a case of younger persons and older persons, choice will go more for the younger person than the older person. And so Professor Nili is right in saying, look, there's no choice you make that will not hurt someone's. And because in as much as you want to look at it, you will just keep exploring more avenues of a saving life, adopting a holistic approach, because each approach that we adopt has its limitation according to our own level of evolution at a point in time. That's my two takeaway. Thank you.
Thank you, Prof. I'm talking about the sort of more holistic approach to it. It brought us to Matthew's area. So let him just say something on that so we cap it up. Just summarize what you say. That's the area, the integration of Orthodox and the
happily, the Chinese and South Africans have advanced further than Nigerian and Ghanaian. Chinese, South African and Ghanaians have advanced further than Nigerian medical practitioners or traditional medical practitioners in that area. I am really happy about it. But I want to see more. I really want to see more. And that's all for now.
Like people said, like I was trying to say, when the researchers from England came, they asked him, why any kidney? He said yes. He said his own method works on the subconscious. If your consciousness accepts it, if it works by what you can call faith or whatever, if your consciousness accepts it. So at that point, that what does an organ represent in a mammal? Because all mammals are similar in structure. And so what is the kidney supposed to do? The kidney is supposed to be the cleanser, kind of cleanser of bad water. The kidney of a mice is not the same thing it does. Yes. It's that symbolism. Symbolism is the word here. That symbolism of the function an organ plays is what matters. Its own method. Are you getting it? Meanwhile, the orthodox scientific method, it doesn't work that way. It must be clinical. And so that's why I say we should adopt a holistic approach, because there are some other approaches that that are more clinical, and others are more maybe I say liberal, more inclusive. But my own position is that whichever method we choose to promote must be such that it can save life, and must be proven and tested that it does so.
Okay, thank you. Thank you for the contribution. Thank you for the presentation. We'll continue to explore the areas that will improve human life and flourishing in terms of good health and healthy living. Thank you.